Hello, I'm Dr. John Hancock, Executive Dean of McGovern Medical School. Our goal as a medical school is to prepare tomorrow's doctors for tomorrow's challenges. Robots are now a common presence in operating rooms, providing enhanced dexterity, visualization, and precision. It is important that our future surgeons are prepared for this and learn robotic techniques early in their training. Let's hear more about how McGovern Medical School is indeed readying our students for dealing with this new robotic environment.
So our residents are started on the robot as interns. So even right before they start their internship, they go to boot camp where they learn some basic surgery skills to try to prepare them for residency. And so one of those things that they do at boot camp is robotic training, which entails doing some online courses to learn about the robot and then doing an in-person hands-on lab to actually get experience with the robot. And then throughout, even starting from intern year, we have them work as a bedside assist in the operating room. As they get more senior, they can sit on the robotic console and actually be the operating surgeon on the console. We have a simulator that they can practice on throughout their residency, actually at multiple locations that they attend, so that's available for them as well.
Robotic surgery education in McGovern Medical School is a very integrated curriculum program which involves didactics and simulation and hands-on training. We have our residents gets exposed to this at the Year 1 training when they're PGY1 in terms of having them access the robotic platform to get familiarized with the system. Then they have an in-service and a workshop where they learn about OR setup, how you place ports for the robotic surgery, what are the emergency procedures, what procedures can you do robotically. And then as a second year residents, we have them complete their simulation, which is done via an online modules and where they perform or simulate the surgical steps in gynecology surgery. They have to score certain level to be able to pass that modules. And then once they've completed that, their hands-on training is done at the level of third year and fourth year residents when they get one-on-one training in the operating room by sitting on the console and performing surgeries by supervision.
So the medical students, I'd say more observe with the robot. However, I think it's actually a great way for them to observe surgery. When they're in like an open case, you know, as the medical student, you're kind of standing down at the feet, you can only see so much. Whereas on the robot, they have the same view I have. So they can really see everything. And you can have multiple students in the room and they can all see. So I think for learning surgery, especially for people who are just coming into the OR for the first time, that's kind of a really accessible way for them to be able to see what's going on. Really, robotics has taken off. It's used in almost every surgical field at this point. So general surgery, urology and gynecology use it, thoracic surgery uses it, surgical oncology, even cardiovascular surgery. So it's used in all sorts of surgical fields. It's really taken off because it allows us to do things in a minimally invasive fashion that we used to have to do open. So I think patients like it, we have better outcomes. It used to be more of a replacement for laparoscopic surgery in a lot of ways, because it does make some things a little easier to do. However, now I think there are surgeries that really you can't do very easily laparoscopically. So they were traditionally done open, but now we do them robotically. So it's made a huge impact in that sense.
I see the benefits of robotic surgery in terms of patients, in terms of surgeons, and in terms of organization in the hospital. Where I see the patients get benefit from robotic surgery is that you can perform minimally invasive surgery for more complex pathology. So they, again, have better outcome in terms of pain control, return back to activities, and avoid large incisions. In terms of surgeons, it provides better dexterity. 3D view helps you see better, and also being able to work in small spaces with more precision. In terms of organization and hospital, most of our robotic surgeries performed in gynecology, our patients go home from PACU in about 3 to 4 hours, and allowing us to have inpatient beds and space available for sicker patients. Robotic surgery will need collaboration, not just with the surgeons, engineers who are the brain behind this, the IT specialists, that we could come up with this and use artificial intelligence for us to come up with this 3D models as we are operating, so we can actually do even more surgery precisely for our outcomes for our patients.
Healthcare and robotics are increasingly intertwined. Our medical students are preparing for this reality while still maintaining the human touch. Thank you for joining me for this episode of Hancock's Headlines.